अभी तो इसमें ठीक दिखा रहा है. Okay, so now we will see the signs of estrus. वो वाली लाइट भी चालू कर दोगे क्या? वो वाली. Firstly, signs of estrus. So signs of estrus in the case of mare. In the mare, we'll see, we all know winking of clitoris. This is very important in the case of mares. Along with this, we have frequent adopting, micturition, posture, and swelling of vulva and mucus discharge. Okay, these are important signs in the case of doe. Doe, we have the shaking of tail, and homosexual mating. Then, in the case of ewe, we have the REM seeking behavior. ठीक है. Then, if we talk about pigs, so in the pigs, we have lordosis, positive back pressure, tail wagging, grunt, also cocking of ear, receptive grunt. ग्रंट कैसा होता है? तो इट इज द रिसेप्टिव ग्रंट एंड स्टेशनरी स्टैंस. ठीक है. अपार्ट फ्रॉम दिस, इन dogs we have tail turning reflex. About cats, we have फीमेल कैट जो फीमेल रहेगी will rest, female will rest on chest with raised pelvis. ठीक है. So these are the important signs of the estrus. Now one question is asked. Vaginal cytology में, in the case of vaginal cytology, the vaginal fluid which we get or discharge we get, fluid or the discharge, fluid or discharge, it is stained with Leishman stain. Okay, we stain it with the Leishman stain. In the estrus, we get vagina lined by the stratified, very important, squamous epithelium. This is in the case of bitches. This is in the case of bitches. And it is lined by stratified squamous epithelium due to high estrogen level. Due to the high estrogen level, it is lined by this. Okay. Now we'll go to we'll find the time of duration of 2 weeks. What it indicates. Okay. So duration between 2 weeks. First, if it is 7 days, means it is a case of acute endometritis. If 2 weeks, then it is endometritis. If heat comes in 15 days, endometritis, then if in 2 to 3 days heat, and if the heat comes, the time between 2 heats and 3 days, early embryonic death का case है, then 42 to 45 days, this means it is a silent heat. This silent heat thing important. ठीक है. Now malignant ovarian tumor. The name of the malignant ovarian tumor is the dysgerminoma. Okay, malignant ovarian tumor is dysgerminoma. इसके बाद in the ovary, if the ovarian tumor granulosa tumor होता है, granulosa tumor, the opposite sex or stromal all these conditions seen in man's In gynecology, if you know the estrous cycle well, then everything becomes easy. You know, parturition reflex अगर आपको पता है, so पूरा ज़्यादा आपको diseases रटने की दिक्कत नहीं होती. Okay, so we see now the disease condition like allantois. Okay, if we say uh, hydroallantois means allantoid cavity में fluid accumulate हुआ. So amount of fluid. Firstly, the amount of fluid that accumulates in this hydroallantois, it's approximately to 150 liters of the fluid is accumulated. बैरल शेप वेरी इंपॉर्टेंट. कैसा एब्डोमेन हो जाएगा? बैरल शेप का हो जाएगा. इसके बाद व्हाट इज द इटियोलॉजी ऑफ दिस? Because of defects in placenta. Okay, so we can say there can be the placental defects because of which, or secondly due to the twin pregnancy can be seen. Then this is a very rapid process. This is a very rapid process, and the rate of occurrence is 88 to 90% केसेस आपको हाइड्रोएलेंटोइस के मिलेंगे. दो कंडीशन होती है, एमनियोटिक कैविटी में फ्लूइड एक्यूमुलेट होता है हाइड्रोएमनियन एंड अनदर इज हाइड्रोएलेंटोइस. बट जो 90% केसेस आपको मिलते हैं ये आपको बैरल शेप इसमें याद रखना है. देन इसका अकरेंस, देन दिस इज अ रैपिड प्रोसेस है ना, ये सब याद रखना है. फिर देन वी पाल्पेट. ठीक है, पाल्पेशन करते हैं, पाल्पेशन करते horn palpate होता है. We get the horn. Okay. Then color of fluid. Hydroallantois में color of fluid. This is also important. Color of fluid कैसा होता है? Amber colored. Amber colored fluid is there. Watery, transudate. Amber colored fluid is there. It is watery, transudate. And when we diagnose the condition, so animal will be seen as bloated bull frog appearance. Very important. Bloated bullfrog appearance is seen in the case of hydroallantois. Then the prognosis. This prognosis is guarded. Sometimes prognosis is also asked. In the Rapidex book, you will get the questions regarding this. These things, amount of fluid, abdomen, barrel shape, then these all questions are there. Now, this was the case of hydroallantois. Now, one more is amnion. Hydroallantois, we have the amount of fluid accumulated 80 to 150 liter. Abdomen, we see this is the barrel shape. Then it's a twin pregnancy. Then this it develops very rapid. Rate of occurrence, most of the cases which we see is the this hydroallantois only. Then palpation, the horn is palpated. Color of the fluid, amber colored fluid, watery transudate. Then bloated bullfrog appearance, very important. Then prognosis is guarded in this case. Now we have next condition, that is hydrocephalus. amnion. ठीक है? In this hydroamnion condition, if we talk about the rate of occurrence, it's very less, that is 5 to 10% only. We'll see the hydroamnion condition. Then its development is a slow process. It develops very slowly. It requires months to develop. Okay, very slow process. Then in this case, the amount of fluid accumulated is approximately 20 to 100 liters fluid is accumulated in this. And when we talk about the abdomen, so we'll get the pear shape abdomen in this case. Pear shape, वहां पे कैसा मिल रहा था, barrel shape, यहाँ कैसा मिलेगा, pear shape abdomen. Then this is a congenital defect. This is a congenital defect. And in this case, there we can palpate the horn. Here we can palpate the fetus is palpated. Then if we talk about the fluid is mucoid, transparent, transparent, muconium. ठीक है? तो क्या है? Good to fair. In this, I feel this is important. Tear shape. Now third defect is anasarca. Anasarca. This is a autosomal defect, and this is common in the question which is asked is it is common in Ayrshire breed of cattle. ठीक है? It is common in Ayrshire breed of cattle. And hydroallantois, and we have mummification. Mummification. Okay. In common in 3 to 8 months of it is present. देन इसमें जो ऑस होता है मनी क्लोज होता है, सो यहाँ पे इन्फेक्शन एब्सेंट रहेगा. इन्फेक्ट seen in Chelsea and Guernsey cow, also in the which is hematic. Hematic mummification is common in cattle. In this present. We have peperaceous mummification. Peperaceous in the other animals, and in this case CSM. Okay. Now the etiology of this, it is in the cattle. In the cattle, mummification occurs because of the umbilical cord compression. Because umbilical cord compress, mummification occurs. Okay. Then dog, we see it in the herpes virus infection. Then animal with twin pregnancy. And the treatment. Drug of choice for this is the PGF2 alpha and also the estrogen. This is the drug of choice. ममिफिकेशन के केस में हमको ये कभी कभी पूछ लेते हैं किसके केस में इन्फेक्शन नहीं होगा, ये पूछेंगे है ना। एंड दिस हीमेटिक ममिफिकेशन किस में होगा, में होगा, सीएल का प्रेजेंस है कि नहीं, दीज ऑल मस्ट फ्रॉम दिस थिंग। ओके, now after the mummification we have the maceration. After mummification we have maceration. ठीक है, this maceration syndrome is seen in the case of late gestation. ठीक है, in this maceration the CL absent. Okay, the os is open. The os is open, so infections will be present. Infections will be present because the os is open, so infections will be present in this case. And it is most commonly seen in the case of the cattles. Maceration is most commonly seen in the case of the cattles. Now, when we do the per rectal examination, when we do the per rectal examination, we'll find the gritty sensation is there. है ना? Bones रहेंगी, this is important. Gritty sensation is there. Then treatment if we give, so PGF2 alpha is given. PGF2 alpha is given. In this maceration cases, oxytocin contraindicated. Okay, oxytocin is contraindicated. Now we have one test, Pickman-Moore test. Pickman-Moore test. This Pickman-Moore test is used for diagnosis brucella in dog. Important. This is again was एक बार आप गायनेकोलॉजी के टेस्ट, ठीक है, उसके बाद वी हैव say we have the perimetritis. Perimetritis means inflammation of the serosa lining of the uterus, है ना। जब serosa lining का inflammation होता है, that is known as the perimetritis. If we say there is parametritis, parametritis when there is the inflammation of the ligament, when the ligament of the uterus is involved, so that is the parametritis. One important disease of these cattle, that is the endometritis. In the case of endometritis, its up to which layer of the uterus? That is stratum spongiosum. Important, remember this. It affects the till the stratum spongiosum layer. Okay. So first thing is this. Then secondly, it not produce the systemic infection. आपको एंडोमेट्राइटिस में कभी भी सिस्टमिक इन्फेक्शन नहीं मिलेगा. It not produce the systemic infection. Then it is more common in buffalo than in the case of the cattle. Then if we want to diagnose this, it is diagnosed by the white side test. Very important. White side test. This white side test is used to determine the subclinical form. Mainly, आपको जब subclinical form determine करना है, this test is used, and in this case, 5% NaOH is used. 5% NaOH. 5% NaOH is used. Then, for the drug of choice for this is the penicillin. Penicillin is the drug of choice, and mm, for the oxytocin and estrogen. ठीक है. This is endometritis. Now we come to one more disease, that is metritis. ठीक है. So metritis में क्या होगा? Inflammation of all the layers of the uterus. All layers of uterus का जब inflammation होता है, that is known as the metritis. And so because all layers of uterus is involved, so there will be the systemic infection present in this case. Systemic infection present in this case. ठीक है. Now, one more type of metritis is there, that is known as perpural mastitis. ठीक है. Pural metritis means this metritis 2 to 4 days after parturition. 2 to 4 days after parturition. ठीक है. इसके लिए भी जो ड्रग ऑफ चॉइस है वो है पेनिसिलिन. ठीक है. एंड बट हियर कॉन्ट्राइंडिकेशन इज oxytocin and estrogen. Oxytocin and estrogen, these are contraindicated in the case of the perpural metritis. Now, after metritis, we have prolapse. So, firstly, we'll see the vaginal prolapse. Okay. So, this vaginal prolapse, it is common in cow and ewe. First thing. Okay, what is the etiology? If you will find, so in the case of pig, due to moldy hay feeding and estrus. Then, in the case of dogs, pro-estrus phase and estrus phase जो होता है, in the estrus phase there occurs the vaginal hyperplasia. है ना. मेनली प्रो-estrus phase में क्या हो जाता है, वेजाइनल हाइपरप्लेजिया हो जाता है. उस कारण से प्रोलैप्स के चांसेस इंक्रीज हो जाते हैं. ठीक है. And if we talk about in the case of the dogs, so boxer and cephalic breed of dog, इनमें होता है ज़्यादातर prolapse. Boxer and brachycephalic breed of dog, it is seen. Okay. Now if we talk in the case of the cattle, it is due to high estrogen and low calcium level. ठीक है. And कैटल एंड बफलो में प्री पार्टम देखने को मिलता है वेजाइनल प्रोलैप्स बिफोर पार्चुरेशन, लास्ट 2 to 3 month ऑफ जेस्टेशन. ठीक है. कैटल में ड्यू टू हाई ईस्ट्रोजन एंड लो कैल्शियम, इट इज सीन प्री पार्टम लास्ट 2 to 3 month ऑफ जेस्टेशन. ठीक है. देन वन मोर थिंग, इट इज कॉमन इन pluriparous than primiparous. It is common in pluriparous than the primiparous animals. Now, it has 4 stages. So, it is having the 4th stage. First stage is the intermittent prolapse of vagina. Second is continuous prolapse of vagina. Then third is prolapse of cervix and vagina. Then fourth, necrosis. Okay. Now after this we are coming to next disease, that is uterine prolapse. So in uterine prolapse the synonym are casting of calf bed, casting of calf bed, second casting of withers, third Hindi में, in the Hindi we used to say it as फूल निकलना. Then it is common postpartum. ठीक है. Mostly in the case of cattle, and it involves both the gravid and non-gravid horn. And for treatment of the uterine prolapse, there comes the different types of the methods. Firstly, 3R method, that is reduction, reposition, and retention. 3R method is very important in this case, that is reduction, reposition, retention. Then apart from this 3R method, we can do the treatment by first New Zealand method. This is only for theoretical purpose, just remember it. New Zealand method, progesterone therapy. We can also raise the hind limb. Then Caslick's method. Then Gunnar suture method. Then Machiavello method. Then Ferguson Hansen method. Robert Vulvar clamp. Vast clamp suture. Now, after this, we have the ROP, retention of fetal membrane, retention of placenta. ROP. So, in this, the synonym of ROP, that is retention of fetal membrane, then retention of secundarium, and this is common in pluriparous animals. बफेलो में ज़्यादा हुआ कैटल के कंपैरिजन में. And in the case of twin pregnancy and in the case of late abortion, it's very common. अगर हम नॉर्मल प्लासेंटा एक्सपल्जन की बात करें, नॉर्मल प्लासेंटा expulsion. So normal expulsion of placenta in cow is 8 to 12 hours. Then in mares it's 30 minutes to 2 hours, and in pig it is 20 minutes to 12 hours. Okay. This is the normal placenta expulsion. Now, what are the causes why this ROP occurs? है ना? So, what are the causes of ROP? Causes of ROP. So, it can be because of deficiency of vitamin A, E, calcium. Secondly, decreased suckling. Third, excess of iron. It can be because of these reasons. Now, we talk about the clinical signs. In the case of dog, the lochia, it turn from green color to red color. This is the same. Okay. Then if we want to go for the treatment, so we have oxytocin tocin at the rate 75 to 100 IU for 24 hours. Then we have Euterotone involution, involon, and utrifid boluses are there. Then Furia bolus, intrauterine Furia bolus can be given. Furia intrauterine. Then collagenase therapy is there. Umbilical artery से देते हैं. Mostly in the cases of Mayer, it is used collagenase therapy. Also, if we give the anionic diet, this anionic diet prevents chances of ROP. Okay. And one more thing is there. We can use to treat ROP is the manual removal of the placenta, but this is not valid nowadays. It's not preferred nowadays. So one more, that is manual removal of placenta. This can be done. So firstly, in this case, cervical part is removed. Then from the non-gravid horn, the placenta is removed, and then from the gravid placentome. Okay. Okay. Now we come to the next disease, that is pyometra. Okay. So it occurs secondary to mucometra, and if we see the causes of pyometra, there Corynebacterium pyogens, pyogenic organism. Secondly, Fusobacterium, bacterioid, Corynebacterium pyogens, Fusobacterium bacterioid. Then we have also trichomonas, and when this thing is because of trichomonas pyometra, there is potato soup like consistency, है ना. यूट्रस में आपको पोटैटो सूप लाइक मिलता है. नाउ यहाँ पे आपको कॉर्पस ल्यूटियम प्रेजेंट रहेगा. दिस इज द केस ऑफ फंक्शनल एनिस्ट्रस. Functional anestrus. It's the case of functional anestrus. Then, in this case, pyometra systemic signs will be absent, and there will be डफी कंसिस्टेंसी. जब हम उसको पाल्पेट करते हैं तो यूट्रस का आपको डफी कंसिस्टेंसी मिलता है. ओके. ऑल्सो देयर इज थिकनिंग इन यूटेराइन वॉल. थिकनिंग इन यूटेराइन वॉल is there. This pyometra, it is common in dog 6 to 12 years. It is common in dogs 6 to 12 years. किस फेज में कॉमन होता है? Diestrus phase. It is common in dogs 6 to 12 years. Diestrus phase. अगर हम डायग्नोसिस करते हैं तो आपको यूएसजी में पस पॉकेट्स मिलते हैं. You will get the pus pockets. in the USG in the uterus. Then also along with this you will get polyuria and polydipsia like signs, edipsia, and also neutrophils. We see shift to left condition is seen in this case. USG first pocket shift to left condition is seen in this case. It is increased many folds. The neutrophils are increased in the pyometra. Many folds they are increased. Okay. Now, if pyometra, we'll talk about the cats. Cats. So clinically, we'll see the endometrial hyperplasia. Endometrial hyperplasia is seen in the case of the cats. Now, for the treatment, we can go. The drug of choice is TGF2 alpha. Then the antibiotic which can be given because gram positive, so penicillin can be given in this case. Then also antiprogesterone. Antiprogesterone like mifepristone, in dogs, mifepristone in dogs, eglepristone, eglepristone in horse, and anti-prolactin drug cabergoline can also be used. Anti-prolactin drug cabergoline can also be used. Now, we come to the anestrus. Anestrus. In this anestrus, what happens is increase in the intercalving interval. It is of two types, functional and true anestrus. In the case of functional, Cl is present. In the true anestrus, Cl is absent. So the functional anestrus occurs in the case of pregnancy, pyometra, mummification, mucometra. And this true anestrus, it occurs due to nutritional cause. It is due to the nutritional cause. Then, in the true anestrus, the treatment is by the TGF2 alpha at the rate 5 ml 2 days after AI. And here, the treatment is no. Here, the treatment that can be given is TGF2 alpha at the rate 5 ml 2 days after AI. Okay. Then also Progesterone and estrogen can be used. Pregnant male serum gonadotropin 1500 to 3000 IU can be used, and also GnRH at the rate 5 ml IV can be used. Apart from these, herbal treatment is also there. Treatment Prajna, Sajni, and Genova. Prajna, Sajni, Prajna, Sajni, and Genova. This is used. Now, the next case is repeat bleeding. Repeat bleeding. So, in the case of repeat bleeding, there is decrease in conception rate by 20%, and number of service will increase. ठीक है? 3 or more. This is the thing. Then female in this case will be having the normal estrus cycle. In the normal estrus cycle. And the main cause of this is early embryonic death, and that is 8 to 16 days, and fertilization failure. Then the treatment is GnRH and human chorionic gonadotropin can be given. This is repeat breeding. In this much you have to remember. Ectopic pregnancy. This ectopic pregnancy, fetus in animals, it is known as mummy, and in the case of human beings, it is known as lithopedio. ठीक है? Now, cause of infertility. Infertility. So it can be because of deficiency of zinc, Mn, cobalt, vitamin A, vitamin E. In case of ruminants, ovary, which is functional, is left side. Okay, sorry, right side. And in the case of horse, pig, birds, the ovary which is functional is the left side. Then endometrial cups. So it is produced by embryonic trophoblast. This is fetal origin, chorionic girdle, and it produces the hormone that is PMSG and HCG. Now, the bilateral salpingitis. It is due to which hormone? That is the estrogen hormone. Then, chemical endometritis. It is due to oxytetracycline. Gangrenous mastitis. It is due to Clostridium. In the metritis, write one thing that in the metritis treatment, ceftiofur can also be given. Okay. And the PGF2 alpha should never be given by the IV route. Okay. Then the weight at puberty is 2/3 of mature weight, and sexual maturity comes when the 3/4 of mature weight is attained. Then birth control method in dog. Megestrol acetate is used. Testosterone, नहीं बोले रहा हूँ. Okay. Now we have one important disease that is the cystic ovarian disease. COD. So in this disease is common in cows, then it is more common in lactating animals in second and third lactation, then it is due to increase in protein and it occurs in the winter season. Then we have two type of cyst. One is ovulatory. Ovulatory cyst is the cystic corpus luteum and an ovulatory cyst. An ovulatory cyst. This an ovulatory cyst, it is of two types. First is the follicular cyst and second is the luteal cyst. Okay, so firstly we'll talk about the follicular cyst. Follicular cyst. So firstly it is multiple in number, pehla point. Then it is involved. Then fluid present is straw colored. Then it persists for 10 days. Then USG, we'll see the anechoic image, echoic image. Then size 2.5 centimeter or more. Then the sequel osteoporosis, osteoporosis, nymphomania, buller-like activity, sterility hump. Also, clinical sign, Swiss cheese appearance and production of hydro and mucometra. Production of hydro and mucometra. Then, if we go for the treatment of the follicular cyst, GnRH at the rate 5 ml, then HCG at the rate 3000 to 5000 IU, then progesterone, and fourth is the GPG protocol. What happens in this GP protocol? 0th day GnRH is injected, then on 9th day AI is done, and again on the 11th day AI is done. Okay. Now we have the next case, that is the luteal cyst. So luteal cyst is single in number, single. This is thick walled cyst and the fluid of this is amber color. Then persist for months and USG hypoechoic image is seen and size is again 2.5 centimeter or more. And clinical sign of luteal cyst, that is, here we'll see anestrus and adrenal virilism, and treatment is given by PGF2 alpha, which is the drug of choice in this case. Now, after this COD, and that is the cystic ovarian degeneration, we have next thing, that is pseudo pregnancy. Pseudo pregnancy. So, pseudo pregnancy causes imbalance of progesterone and prolactin, and the treatment for this condition is anti-prolactin drugs, and that is bromocriptine at the rate 20 microgram per kg. Second, cabergoline at the rate 9 microgram per kg. This cabergoline is called as best drug for pseudo pregnancy in witches. Then also, apart from anti-prolactin drugs, we have the anti-serotonergic drugs. Serotonergic drugs, they are metergoline at the rate 0.1 mg per kg. Now, in male, pseudo pregnancy is known as breed, and in doe, cloudburst. In pseudo pregnancy, prolongation of luteal phase is seen. There is prolongation of luteal phase in the pseudo pregnancy. Now, transmissible vaginal tumor. First thing in this, the chromosome number. Chromosome, it changes from 78 to 56. First thing. Then for the treatment, there are two drugs. First is the vincristine, and this vincristine is given at the rate 0.025 mg per kg, and second is cyclophosphamide at the rate 5 mg per kg. Now next is superfecundation. Superfecundation. So superfecundation is very common in dog, cat, mare, Holstein Friesian cow. Okay. Now superfecation in pig and cows. Potency of fallopian ट्यूब अगर चेक करनी है उसके लिए we have the PSP test, CO2 inflation test, and starch test. Now, melicotium, it is known as chimera. Then uterine unicornis, this is known as king uterus, and uterine didelphus. Uterine didelphus, failure of Mullerian duct to fuse. Okay. Now we'll study the mismating. If mismating हो गई है, then for the treatment of mismating, in 2 to 3 weeks of pregnancy, in 2 to 3 weeks of pregnancy, we can give the luteolise at the rate 0.1 mg per kg. Luteolise can be given except in dogs. In place of luteolise in dog, epidocin is given. If more than 3 week pregnancy is there, in that case, estradiol valerate at the rate 0.01 and estradiol benzoate at the rate 0.04. ठीक है? This prevent zygote transport, hence implantation. Then we have dopamine antagonist, bromocriptine at the rate 2.5 mg, and cabergoline at the rate 0.5 mg can be given. Now, antiprogestin can also be used like ecostin and mifepristone and aglapristone. So this mifepristone, this is the best drug in canines. Also, Gynaecology agonist can be given. Tamoxifen can be given, and dexamethasone can also be given. Now, in the cases of delayed ovulation, treatment is LH or Corulon at the rate 3000 IU and GnRH at the rate 500. This is the delayed ovulation case. Then seasonal breeding. Control is by the female body. Long day breeder is mare and short day breeder is sheep and goat. Now, Bruce effect. Bruce, Bruce effect is presence of male. In presence of male, pregnant female will abort and mate with new male. Okay. Now, these effects are very important. When Witten's effect, in this male animal will help in heat synchronization. Calf to service duration is 65 to 70 days and calving to conception is 85 to 90 days. Okay. So this completes our gynecology, and in the next class we'll do the obstetrics. Okay. So there are some numbers regarding this we have to remember in the gynecology and obstetrics. I'll upload that in the study material thing. Okay. In the app, I'll upload that things. Okay. So this is the complete gynecology. Uh, just remember, learn, just understand the estrous cycle very carefully, and then you will be able to remember all these points. Okay. Thank you.